Bismillahirrahmanirrahim. Today my topic of presentation is Health Management Information System, its introduction, steps for development, requirements and component of Health Management Information System. وَتَوَكَّلْ عَلَى اللَّهِ وَكَفَى بِاللَّهِ وَكِيلًا, and put the trust in Allah, and enough is Allah as a disposer of affairs. Learning outlines. Introduction of Health Management Information System, characteristics of information by HMIS, and need for the management information system in primary healthcare programs, building blocks of health management information system, components and important features of HMIS, and steps in the development of health management information system, various indicators and type of indicators related with HMIS, and some recent advances. By the end of this presentation, participants will be able to describe the introduction, building blocks of health management information system, component information, important features, indicator and types of indicators related with HMIS. Introduction. In 1978 year was the milestone in the history of healthcare development. It is the year of Alma Ata Declaration, and it is the year in which the Alma Ata Declaration, which have declaration that is role to launch a effort um, global effort for people, for example, health for all by the year 2000, to achieve the health for all by year 2000. And the basic aim is to permit the individual to lead a socially and economically productive life. And the key approach to achieve health for all is through primary healthcare principles, which are based on four principles: community participation, universal coverage of defined population, equity or care according to needs, culturally acceptable health care, and provision of health care at a minimum cost. But in 1987, WHO expert committee evaluated the strategy of health for all by year 2000, and they found that the main constraint in all countries for the strategies of health for all is inadequate information for managerial process, which is required for systematic and analytical information for continuous assessment of situation, determination of priorities, improvement of management and evaluation. And they found that health for all required the integrated managerial approach for continuous process, and therefore there is need of modification or readjustment in the strategy as a continuous process. And with the development or coming decades, the world community more focused on Millennium Development Targets, and they more focus on achieving the Millennium Development Targets. And with the few decades, there is also increasing of communicable disease such as HIV and AIDS, tuberculosis, and malaria. And the decision makers highlighted the need of reliable information which is required for decision making. And the donor also leads changes pathway, and they release fund to performance-based measures in all countries. And decision maker highlighted the need of reliable information. The information which is required at all levels, from the federal government which are required for policy making to basic level healthcare facility in the periphery, or at the home level by individual family members and the donor agencies for funding. And this requires some type of information system and reliable information system. Therefore, the need for development of health management information system is there, and which is required by policymaker, clinician, and health service users to improve and protect population health. Because there is no there is inadequate information for managerial process. Now, definition of health management information system. What is a health management information system? It is a mechanism for the collection, processing, analysis, and transmission of information required for organizing and operating health services, and also for research and training. The information generated facilitated evidence-based decision-making, effective management of health care system at all levels, central, local, international, assist planners and policymakers in study current function and trends in demand and workload. The characteristics of information by health management information system. The efficient and effective health management information system generate information that must be reliable, relevant, up to date, adequate, timely, and reasonably adequate. Building blocks of health management information system. There is in intelligence hierarchy pyramid and health management information consists of the first is data. Data which is actually consists of discrete observation of attributes or any happening or event. These fact and figure may be in qualitative or quantitative, but it is the raw and data may not have any meaning. But when data is processed, for example, after adjustment, reduction, summarization, and change into meaningful form, then it becomes the information or useful, which give communicating meaning or so that we can communicate meaning, then it become information. Now, after information is come in the pyramid is knowledge. Knowledge is typically defined with the reference to information, and it has been when data has been processed, organized, or structured in some way that this can be applied in some action form or put it to action, then it becomes the knowledge. Knowledge, we can say that justified through belief. Then at the top is wisdom or intelligence. Wisdom is actually the ability to increase effectiveness, the knowledge and experience needed to make sensible decision and judgment, and the wisdom add values. And wisdom is actually the mental function that we call judgment. And the data that is not transferred into information, and the information that is not utilized for decision making after application of knowledge and wisdom is no value. Now there is some term which is again used and in the health management information system, which is, one is efficiency and other is effectiveness. The main difference is efficiency is the completion of health tasks with minimum cost and optimum utilization of resources, whereas effectiveness is completion of health tasks on time, no matter whatever the cost. The efficiency concerned with cost benefit analysis and effectiveness concerned with achievement of end results. In efficiency, cost is the main consideration, quantity based, and effectiveness time is main consideration. Efficiency is actually in the doing the task in right way, and effectiveness is doing the right task. Mean in effectiveness, person requires a project on time, know how whatever the cost is. Whereas efficiency is minimum input to maximum utilization of source to maximum output. For example, resource utilization, if goal is if effective a project but not efficient, then goal is achieved and resource is wasted. If effective and efficient, goals achieved, no wasted resources and high productivity of project. If there is neither effective any project or not efficient, then goals not achieved, resource is wasted. If not effective but efficient, then goals not achieved and no wasted resources. Why there is need for health management information system in primary healthcare programs? Effective primary healthcare programs require constant seeing of personal activities, adequate provision of the drugs and supplies, effectiveness of intervention strategies. Management information system provides the necessary tools for establishing the infrastructure for management and supervision, and information needed at all levels, and the purpose of uses of information different at different levels. For example, the information may be generated in the example of health monitoring, and any health monitoring promotion component of primary healthcare program running in any XYZ community. The health care worker and parents are interested in the information of health status of children. They measure or use the height and weights of the children to monitor the health status of children, whereas primary healthcare supervisor required for which can be LHB or community health nurse is mainly interested in coverage and efficiency of the program. Means he or me she interested to know about the total target population of under 5 year children which have been monitored for growth promotion in last quarter, or what proportions are malnourished. And primary healthcare program manager and supervisor actually is concerned with the information about the which can use for effectiveness intervention, and they monitor the effectiveness of intervention, and they need to know the number of children malnourished, what proportion show improvement and what proportion show no improvement at a given period of time, because they can actually concern with monitor the effectiveness of intervention. Whereas planner use information from GMP, growth monitoring and promotion component to compare alternative methods of growth monitoring and assessment of program effectiveness and efficiency and for making decisions. For example, there are two methods. One is more effective and other is efficient and other is not efficient. Then they make comparison, make decisions for further planning and further approval of the method which is more efficient and both effective, because efficiency and effectiveness are complementary to each other. Now, essential elements of a health management information system. Management has always has three essential elements. First is input component of health management information system, which are consist of on the data on selected activities or happening that will produce the required information. Then come the data processing component, in which the data is collected, aggregated, analyzed, and presented on time in understandable format. Then data after processing, we obtain the output, which is a processed information output, and they can be consist of processed information to satisfy one or more user need. Now there is steps in development of health management information system. First step is the planning and designing phase. It is a first phase which ensures that the health management information system generate or ensure valuable information generation. The planning actually depends on the objectives of program, which start situation analysis, budgeting, and development of software. After all these planning and designing, there comes the implementation phase, and this phase is most expensive and time consuming phase. And it consists of training manpower, report forms, reports distribution, data entry and screens, software, data collection form, data transfer, data processing procedures. After implementation phase, there comes the monitoring and evaluation phase. It is actually the phase of inquiry in the performance of the programs that includes the periodic audits or maintenance to ensure that the system is functioning properly or not. What is monitoring or evaluation? Monitoring is actually the periodic which is occur regularly and day-to-day overseeing of program, whereas evaluation is episodic. The monitoring function is to see oversight or tracking, whereas evaluation function is to see assessment or evaluate. Its purpose is to improve efficiency monitoring, whereas evaluation associated with increased effectiveness. It focuses input, output, process, and work plans, operational implementation, whereas evaluation is increased effectiveness, relevance, impact, and population effect. It is done through monitoring, a routine view of reports, register, administrative databases, or field observation, whereas evaluation requires scientific rigorous research design. Information source is routine sentinel system, field observation reports, progress reports, whereas evaluation is same sources used for monitoring, thus population-based survey. Cost in monitoring, it is consistent recurrent cost spread across implementation period, whereas evaluation is episodic, often focused at the midpoint. Types of valuation. Evaluation may be two types: formative evaluation and systematic evaluation. Formative evaluation is the process that goes on all through the implementation phase of program. It is very important as major changes might be made in the program during implementation phase. Whereas summative is used at the end or end of the program. These two types, process or formative evaluation, is ongoing types of evaluation, whereas the impact or outcome evaluation or summative is final. Process evaluation is actually the evaluates how the project outcomes were worked towards and the effectiveness of this process. Whereas impact or outcome evaluate the impact resulting from project and what has changed as a result. Essential requirements of a health management information system. The health management information system should be population based, employ functional and operational terms, avoid unnecessary agglomeration of data, express information briefly and imaginatively, problem oriented, make provision of feedback of data. Components of health management information system: demography, vital statistic, environmental health statistic, health status in form of mortality, morbidity, disability, and quality of life, utilization and non-utilization of health service attendance, admission and waiting list, indices of outcome of medical care, financial statistic related to particular objective. Now there is important features of HMIS. First is relevant data collected to MIS should be relevant. Standardization. Management should ensure uniformity in definition of variables collected. Inconsistency pose problem and comparing impact of intervention. Data collecting and aggregating instrument should be simple and easily understood by users. Example: growth monitoring chart in community primary healthcare program and management information system quarterly report shown. For example, this is a monthly report chart of diet which is shown and the growth meeting chart, and it is the example of management information system quarterly report of Aga Khan University Urban Primary Healthcare Program. Data presentation process: data should be presented in appropriate format which is easily understood. For example, there is a distribution of children, gender, percentage according to weight condition presented in the form of chart or easily presentable way. Flow of information. The collection of data, processing and flow of information should be on time to the supervisor so that the appropriate information should be available for decision making. Information on the number of malnutrition children showing no change in weight in last 3 months does not reach supervisor on time, when then important decision for action will be delayed. This is actually the screen from community, a community health worker, individual reports, daily health visitor, aggregation sheet with nurse and doctor, then management information system, and there is also information feedback, information flow, and feedback system. Filtration of information. A lot of information is generated by MIS, but all these may not relevant at every level of decision making, and only required information for decision making at particular level needs to be forwarded. Feedback. After processing the data into information, feedback at all levels should be inbuilt in the system so that the people collecting data appreciate its uses. Example at the flow. Example of feedback at family level: feedback on weight gain of children as demonstrated by direction of curve on road to health chart would stimulate the interest for mothers. For example, if we can explain the road to health chart, the mother then mother increase interest about the nutritional status of child. Maybe there is aggregated data on growth monitoring program in target population gives information on health personnel on the effectiveness of growth growth monitoring program strategy on health status of all children in community when there is appropriate feedback. Information collected from health management information system is solving issues. However, the health management information system is collected wide range of information system, but they utilize but internationally data on solving issues must be collected. For example, epidemic disease, drug supply and distribution, physician preventive care for mothers, extended program, immunization, family planning, malaria, TB, acute respiratory tract infection, childhood disintegrative disorders, status of instrument, equipment, drugs, manpower, and 18 priority health programs. This is the 18 priority health programs, which include diarrhea, dysentery, acute respiratory tract, fever, cough, suspected cholera, meningococcal meningitis, poliomyelitis, measles, neonatal tetanus, diphtheria, whooping cough, goiter, AIDS, viral hepatitis, snake bite, dog bite, or scabies. Now, indicators. Indicators are the variables which can help measure changes of effectiveness or degree of efficiency are called indicators. An ideal indicator should be accurate or reliable. Accurate means they actually measure what they're supposed to measure, and reliable means answer should be the same if measured by different people in similar circumstances. Indicator may be input indicator, for example, input in program, resource allocation, manpower, finances, and drugs. Process indicators is actually indicator by estimating efficiency. For example, the portion of malnutrition children having weight gain last quarter. Output indicators measure the quantity of service utilization during program. Impact indicators actually indicators which measure the effectiveness of the program, infant and maternal mortality. The process indicators measure the efficiency. and the impact indicator actually measure the effectiveness of program. For example, input may availability of drugs, basic component, number of staff required, number of drugs, and output then become the number of children immunized, number of new cases in facilities, hospital, bed occupation rate. It is actually the output which show the efficiency. Then come the outcome. Outcome is actually associated with utilization, full utilization of services, which show the full immunization rate, intervention, incidence and prevalence of certain disease such as HIV, malaria, TB, and number of TB cases detected. And impact is shows the effectiveness of program, which is actually shown through rates. For example, life expectancy at birth, infant mortality rate, maternal mortality rate, prevalence of malnutrition children under 5 years. There may be strategic and operational issues in management information system because data needed in comprehensive health is ranged from birth, morbidity or mortality, type and location of health personnel, type and quality of clinical services provided, and population indicators which may be demographic or socioeconomic. And this information system therefore divided into different domains of health management information system. One domain is health system inputs, which may be policy, financing, or human resource organizations. And then come the health system output domain, which consists of information, service availability, and quality. Whereas health system outcomes is associated with service utilizations. And then there is output is health status, which is indicated in formation of mortality, morbidity, disability, and well-being. And these are related with health determinants also, which may be risk factor, behavior, genetic factors, and socioeconomic demographic factors. Now comes some recent advances. One article is related with health management information data verification, a case study in 4 districts in Rwanda. This is article is actually to review the quality of Rwandan health management information data for maternal documents. They conducted cross-sectional study in 76 health facilities in 4 Rwandan districts for 14 maternal and child health data elements. And for the WHO guidelines on health management, data verification was used, and the verification factor was defined as the ratio of register over HMIS data. Results: health high proportion of health facility achieved an acceptable verification factor of WHO for data on number of deliveries, antenatal care, new registries, live births, and newborn who received first postnatal care within 24 hours. This was slightly lower for the number of women who received iron or folic acid level tested for syphilis, and was lowest for number of women with ANC first standard visit. Therefore, this article conclude that there was variable HMIS data quality by data element, with some indicator with high quality and consistently reporting trends across district. Over-reporting was also observed for ANC-related data, more complex circularization, knowledge of gestational age, scheduling to determine ANC standard visit, as well as quality. And there is also data quality assessment and training to address gaps could help improve HMIS data quality. There is also the article which is related with assessment of implementation of health management information system at the district level in South Malawi. Its objective is to determine the implementation of health management information system at district level. It is actually the cross-sectional survey which use both quantitative and qualitative technique through in-depth interviews, documentary review, and focus group discussion. And it consists of 10 HMIS officers and 10 district health managers from 10 districts. The study established based on the study officer stated that HIMS data collectors from district hospital, health facility, and community included medical assistant, nurse, midwife, statistical clerks, and health surveillance assistant um, are used for health management data collectors. And the challenges within system including inadequate resources, knowledge gap, inadequate of staff, lack of training, and refresher courses, which collectively contribute to unreliable information and therefore poorly informed decision making. And there is also varying availability and utilization of different data collection tools contributed to data inaccuracies in implementation of health management information system. There is also article published about the role of health management information system in disease reporting in rural district of Sindh in Pakistan, and is actually the health MHA system is poorly designed and data collection is mostly incomplete, inaccurate, ultimately unrelated, which has little help in decision making. It is a descriptive level study and depend on monthly report of 34 health facility on priority disease. And results showed that 34 health facility out of 72 are reporting, 38 were not reporting any data, and trained personnel was employed in 27% of health facilities, and 62% report received were found to be accurate. And 79% cases of any action was taken. Inappropriate maintenance of record, lack of interest, cooperation of facility staff, inadequate staffing, and poor supervision were factors associated with affecting the reporting of health management information system. There is also article which shows that the Pakistan Health Management Information System of Health Manager perspective, there is perception they highlighted some strength that there is sustainability of system, even suspension of funds from donors and coverage of over 10,000 health facility, logistic and drug support system. But the weakness of this system is that there is scarcity of resources, skilled personnel, financial resources, conscientious quality, and underutilization of data, lack of motivation and feedback among health managers. Another report is which is the routine health information system in Punjab province in Pakistan, which explore the potential for health for integrating the health management information system, especially for family planning data. Globally, there is two types of routine and non-routine according to this report health data. And in developed countries, routine health information data exists in true sense, having both facility-based and community-based information system. With the situation different in developing countries in Pakistan, in Punjab, health management is fragmented as there is more than 220 different HMIS with dedicated vertical channels. Among these three systems gather and transmit information to family planning. For example, district health information system, the lady health worker information system, contraceptive logistic management information system, some population welfare department, and some NGOs. And the objective of this was to review the routine health information system in Punjab province and explore the potential for integrating community level data into national level data, particularly family planning. And profit and non-profit or community-based data. And there is structural barriers they found that there is fake entries, inadequate information, dissertation, and types of family planning and inaccurate data, duplication of data, over-reporting, poor feedback mechanism. And therefore, they recommend that there is appropriate strengthening and computerized national identity card and psychosocial behavioral indicators to uptake, switching, and dropping of modern family planning methods. Now come towards MCQs. Given there are two statements, statement A is resource allocation in terms of manpower, finances, and drugs in any healthcare program. Statement B is utilization of health services. In the context of these information, identify the types of health system domain. Whether statement A is input domains or B is impact domain. Statement A is output domain and B is impact domain. Statement A is input domain and B is outcome domain. Statement A is input domain and B is process domain.
A. C.
C is correct answer because A is resource allocation, which is actually input in the form of manpower, and B is utilization of health services, which is actually the services utilization come under the health system outcome domain. So C is correct answer. In ongoing maternal and child health program in ABC community, a MCH program manager and supervisor came to know that program is not effective and showing no change in maternal mortality rate after 6 month phase evaluation. In the context of this scenario, identify the type of health system indicator: input, impact, process, or outcome indicator.
Output indicator.
Impact indicator because
Impact.
Impact because program is not effective and showing no change, and impact indicator is actually determining the effectiveness of any program. Aggregated data on ongoing MCH program in ABC community gives information to MCH program manager about maximum utilization of ANC services. In the context of this scenario, identify the type of health system indicator: input, impact, process, output, or outcome indicator. Outcome indicator, because outcome indicators show the maximum utilization of services. A growth, meeting and promotion program under 5-year children are started in XYZ community. After 3 months of evaluation, program supervisor found that information on number of malnutrition children showing no change and number of severe malnourishment and death increase among children, and important action with decision making were also delayed. The most likely reason for this may be due to irrelevant information was reached to supervisor. Flow of information did not reach the supervisor on time. There is no feedback system and there is no uniformity in definition of variables.
C.
B.
B. Because information is also according to uniformity, malnutrition information is going and there is no irrelevant information. Feedback system is actually not related to this. Only the main reason is that the flow of information did not reach the supervisor on time and therefore the important action is will also become delayed. Main reason is B. A team of health manager and supervisor evaluate the effectiveness of family planning program in XYZ community. They collected following information from program. Which of the following, which include A information is number of health personnel trained, information B number of family planning contraceptive brochures disseminated, number of clients served monthly, and increase in contraceptive knowledge and use. Which information will be considered as evaluation information? Information A and C, D and B. C is correct answer, information D, because all these is normally the monitoring purpose day to day, which is include daily activities, for example, increasing efficiency, number of personnel trained, family planning contraceptive brochures disseminated, and number of clients served. The increase in contraceptive knowledge and use is actually show the effectiveness of the program, and the effectiveness is actually real in the evaluation, and therefore this information is will be considered as useful for health manager to assess the evaluation. Health manager conducting evaluation during the implementation phase for vitamin A supplementation program in children against blindness in ABC community. This type of information will be summative, formative, impact of process evaluation.
Formative.
Yes, formative.
B.
Yes, because it is the process that goes on through the implementation phase of programs, therefore it is formative. A group of public health team planned to develop a HMA system for family planning in XYZ community, in which health workers visit homes and address the contraceptive needs of family. And they include following: planning and designing phase of maternal situation analysis, budgeting and implementation phase, which include training, report, data collection, and forms and transfer, and monitoring and valuation phase. Which of the following step in development is most expensive and time consuming phase?
D.
Yes, implementation phase is the most expensive and long time consuming phase. Health supervisor conducting evaluation of HMIS system of community based nutritional rehabilitation program in urban ABC town at the end of program. This type of evaluation will be summative, formative.
A.
Yes,
A.
because summative is actually the formal evaluation which is done at the end of the program. In HMIS system for the growth monitoring program in children in XYZ community disseminate following information. For example, information is monthly height and weights of children in the community. 34% of children are malnourished in last 6 months. 12% of children showed improvement and 28 showed no improvement in last 3 months. And monthly measurement of heights and weights of children is more effective than monthly mid-arm circumference measurement in growth monitoring. From which level of information will be useful for health planner in this case? Either information A, B, C, or D.
A.
Health planner, which information is useful for health planner?
B.
Yes, D, because
A.
the A information is monthly height and weights of children in community, which is mainly concerned healthcare worker. And B is actually the 34% proportion of children which is malnourished, and the primary healthcare supervisor is actually concerned about the proportion of children malnourished and trusted in coverage of the any services. And C is actually present the manager, useful for manager because they need to know about the children malnutrition status, whether there is improvement or no change And the health planner is actually concerned with information system uh, related with different methods or alternative method, so that there must be an adequate information system which can be useful for making decision with optimal utilization of resources. And this information is showing the optimal comparison of method which is used for health planning and policy. Health manager of health management information system of MCH program wants to determine the utilization of antenatal care services, infant and maternal mortality rates in APC community. Which type of filtered information is useful for him? He must have the following information, for example, healthcare program, maternal risk factor data, behavior, genetic and environment, financing and manpower, availability and accessibility of healthcare personnel, training policy information. And after filtration of information, it is split into information A, financing and manpower, information B, healthcare personnel training, information C, healthcare personnel training, policy information, and information D, maternal risk factor data, behavior, genetic and availability, accessibility of healthcare. Which filtered information is useful for him or her, according to in this MCH scenario, because he wanted to
D.
determine the utilization of health in natal care. All these are four filtered information provided to him or her. Information D. Because financing and manpower is not directly associated with utilization of antenatal health services, healthcare personnel training is not also healthcare personnel, and information D is absence and maternal risk factor data, behavior, genetics, availability, and accessibility of healthcare, which is directly associated with utilization of antenatal care services, infant and maternal mortality rate in ABC community. And the main essential feature of HMIS is that the filtered information is always given to supervisor, so that the appropriate decision can made at appropriate time. Therefore, the information D is useful. This is the keys of MCQs, references, and thank you.
Thank you very much, Dr. Hansa, for a very comprehensive, focused, and very good presentation. You have presented it very well. However, the most important thing